Hello, my name is Miftah Fadhillah for Stay Indonesia. In this occasion, I will discuss about COVID-19 and the impact on sustainability of human life. About the impact of COVID-19 on the world of health, education, economy, and daily activities. COVID-19 is a disease caused by new coronavirus that was not previously identified in humans. Coronavirus is a group of viruses found in animals and humans. On 30 January 2020, WHO announced an outbreak of new coronavirus COVID-19 as the worldwide public health emergency, where in fact the existence of COVID-19 has been found since late 2019, but not many people know that is coronavirus. Meanwhile, in Indonesia, the initial emergence of COVID-19 was reported on 28 February 2020 from a dance teacher in the city Depok. 2 weeks earlier, this dance teacher had a friend from Japan who has visited her house and danced together. After his friend returned, the dancer teacher felt a cough, flu, and fever. Had checked out the doctor, but the doctor allowed this dancer to be outpatient and allowed to go home. However, due to illness that has not healed and has felt shortness of breath on 26 February 2020, dance teacher returned to the hospital and undergoing inpatient treatment. Then, on 28 February 2020, this dance teacher was reported by a Malaysian foreigner friend that his friend was a Japanese foreigner who was positive for COVID-19. Where before meeting this dancer teacher, the Japanese foreigner also met this Malaysian foreigner. Then the dance teacher spread the news to the nurses at the hospital where he was treated and was referred to RSPI Sulianto Saroso, North Jakarta. Reporting from World Metro Info currently, 6 August 2020, there are 80,979,596 infected people, 12,171,060 people who have recovered, and 711,252 die, with 6,097,278 positive cases in the world. 99% are in state of mild symptoms and can still be resolved, then 1% are in a critical condition, so they need serious treatment. And of the number who have recovered or complete cases, there are 12,882,317 people have a 6% mortality rate, and 94% are patients who have recovered and are allowed to go home. Indonesia is in 23rd place out of 215 infected countries, with 116,871 infected people. 5,452 die, and 73,889 who have recovered and allowed to go home. WHO recommendation regarding the prevention of transmission of the COVID-19 virus. First, recommendation to consume healthy and nutritious foods to maintain a good immune system. Second, suggestion to reduce drinking alcohol and drinks containing high sugar levels. Third, stop smoking. Smoking can increase your risk of seriousness if you're infected with COVID-19. 4. Recommend exercise for 30 minutes per day for adults and 1 hour per day for children. 5th, wear a mask when outside the house, not remove except for eating and drinking. Wash your hands regularly with soap and running water or sanitizer. Steps taken by Indonesia government toward preventing transmission of the COVID-19 virus. 1. Large-scale social restriction or PSBB in Indonesia in a number of regions in Indonesia including DKI Jakarta, West Sumatra, City and District of Bogor, City and District of Bandung, City and District of Bekasi, City and District of Tangerang, South Tangerang City, Pekanbaru City, Makassar City, Tegal City, Depok City, Cimahi City, Mataram City, West Bandung District, and Sumedang District. The social restriction include school and work closed, restriction on religious activities, and restriction on activities in public places of facilities. 2. Since several months ago, to coincide with the holy month of Ramadan, the Ministry of Religion issued several restrictions to prevent the spread of the COVID-19 virus, including first, Tarawih prayer are performed at home, not in mosque. Second, prohibition of breaking the fast together or down together outside the nuclear family. Third, did not do itikaf for the last 10 nights in Ramadan at the mosque. 4. Do not pray it at the mosque but in their homes. Third, COVID-19 has had a fairly broad impact, including on the world of health, economy, education, and daily activity. The world of health regarding vaccine research has yet to find a vaccine for this coronavirus. The facts say that this coronavirus can heal itself, but us must increase body immunity by taking vitamins, eating healthy foods such as vegetables and fruit, as well as exercising can help improve metabolism in the body. Also make it a habit to live clean and always wash your hands with soap and running water or sanitizer. Impact on tense condition where the doctor and nurses were also afraid of this disease. Especially it was not certain how the virus was transmitted. Then lack of supporting facilities such as personal protective equipment or PPE and 95 masks and so on. The impact on doctors who have nothing to do, respiratory disease like dentists or obstetrician also has an impact because outpatients have their own concern when visiting the hospital, even though the health protocol is very strict. The impact of coronavirus on the economy regarding entrepreneurs who have to close, private employees who have to be laid off, ojol who during the PSBB period in Jakarta are not allowed to take passenger, only food, or driver bajai who cannot work. Even though the Indonesian government provides assistance for those affected by coronavirus as much as 6,000 rupiah in case outside Jabodetabek, while in Jabodetabek 6,000 rupiah of groceries per month are not sufficient for 1 month, especially if there are 5 or 6 people in one family who do not have access or facilities to study at home, both cell phone and internet networks. If the teacher is good, he allows his student to come to school and study there, but with certain health protocols. Some even have to study on the brink of being able to get an internet connection. The impact on learning becomes ineffective even to the exclusion of the national exam. Plus, the impact of the coronavirus on daily activities such as working, selling which was temporarily suspended, eliminated for several weeks during the PSBB period in several regions of Indonesia. Transportation and public facilities that have now carried out physical distancing, where each person is given a safe distance of at least 1 meter, which also affect the number of public transport that must be added to meet demand, especially for people who work in open space or meet many people where there is a high risk for them to be infected with coronavirus. Some public services are temporarily closed during the pandemic, or deferred services are carried out online, such as making a taxpayer identification number or NPWP, which is done online and of course with very easy requirement. Just enter your number identity of KTP and family card number so you will get an NPWP easily, so that applicants do not need to leave the house and carry out activities that can expand the spread of this coronavirus. So, there are from me about COVID-19 and the impact on sustainability of human life. See you in the next video. Bye.